I can ask on the cat. Even if I don't go over it on the cat, doesn't mean I'm not going to ask it at all. I can ask it on models or histology slides, okay? But this is just what I could ask on the cat. Here, this outer portion, external nares or nostrils, oral cavity, which we can, this is part of the respiratory system and mostly the digestive. Let's see, okay. Then we have the trachea. So y'all remember seeing the trachea when you had looked at the arteries and veins and all of that. It runs parallel with the external jugulars and the common carotids. But you can see these little rings. Those are the cartilage rings, okay? The hyaline cartilage rings. This top portion of the trachea with lots of hard cartilage, this is the larynx or the voice box, right? This top thicker cartilage, the more superior thicker cartilage, this is the thyroid cartilage. And then right down here, it's usually a little bit darker and you can't really get all of the muscle off. This cartilage right before it gets to the trachea is the cricoid cartilage. So thyroid cartilage most superiorly, okay? And then the cricoid right before it gets into the trachea. Here, this is the trachea. You can see, if I look on the posterior side, you can see the C-shaped nature of the rings. See how it's flimsy on the back side? It's because they're not complete circles. Lying on the posterior side, this flimsy tube, that would be the esophagus. Okay. Looking at the posterior side of the larynx, if you open it up, the first thing you should see at the very top, this duckbill-like structure, this is the epiglottis, made up of elastic cartilage, and that will flap down when you swallow to cover the hole called the glottis. Okay? This inner Pac-Man mouth, these two folds, I just put the probe right between it. These inner folds looks like a Pac-Man mouth. Those are the true vocal cords. Okay? The outer folds, the most lateral folds, those are the false vocal cords. Okay? So true inner folds, true vocal cords look like a Pac-Man mouth. The outer most lateral folds are the false vocal cords. And the hole is the glottis. Okay? Here is the trachea. It's going to lead down. You're not going to be able to see the right and left primary bronchi unless I take away the heart. But the trachea will split into right and left primary bronchi and then innervate the lungs. Okay? So the ribs have been cut away. Normally the rib cage would come and enclose the thoracic cavity. Here's the heart in the center, the lower center portion of the thoracic cavity, and surrounding it, these are the lobes of the lung. Okay? You're not gonna have to tell me right superior, right middle, or right inferior lobe. You just need to be able to tell me right or left lung. Okay? And then right here, this structure that looks like a purple onion that separates the thoracic cavity from the abdominal pelvic, this is the diaphragm. Okay? And that's everything that I could ask on the respiratory for the cat. Okay?